Hello, my name is Kirtland Widener, and in my presentation today, I will be discussing lower limb amputation. For starters, we will be talking about what lower limb amputation is. When any portion of the leg from the hip joint down to the toes is removed for any reason, whether it be from a traumatic injury like a car accident or a fall, or a tumor that was led on from cancer, or health complications, whether that would be blood sugar problems from diabetes or heart problems or anything else dealing with blood pressure. Some history of lower limb amputation. Amputation as a whole is one of the oldest surgery procedures to ever be recorded. In some books, they have the oldest surgery going back to 5000 BC. In some tribes back then, they would have the soldier amputate either a toe or a finger just to show that they are dedicated to the group and they wouldn't back down and they wouldn't leave the tribe's side when they would be in war. Because of the lack of knowledge and production of narcotics, amputation surgery would typically be done in only a couple of minutes, and obviously because they had not a lot of knowledge or production of narcotics, unless you were part of the wealthy group. A lot of times you would be awake and your whatever part was being amputated would not be numbed and you would feel the entire thing. During the Civil War, amputation became one of the most needed surgeries, where about 75% of the battlefield surgeries were amputations. That simply being because of the type of bullets that they were using, which were lead bullets. They would pierce the skin and they would just, once they would get in, they would just shred through tissues and muscles, and at that point there's no real use for that limb anymore, so the best idea was to just amputate it so that the soldier wouldn't be in pain anymore. Now obviously there's a lot more preparation that goes into surgery. They talk about the different narcotics that they could use and what area they're going to be running into and what complications that they could be having if there are any, and if they're removing muscle, how much or how little, and if they're what tissues that they're going to be removing and stuff like that. And depending on the type of surgery and the planning by the doctors, they can either use general anesthesia or local. General is what most people choose, which is the person gets put under for the surgery and they just wake up a half hour after the surgery and everything is fine from there. Or they use local, which is they just numb the area right above where the surgery is happening and the patient will be awake for the entire surgery. What are some of the causes for lower limb amputation? This is just a very short list, but these are the top 5 reasons why people typically have them. Traumatic injury, like I said before, whether that be from a car crash or a fall. Tumor that is caused from cancer. Poor blood flow, whether that would be blood pressure reasons or diabetes, which would lead to blood pressure or blood sugar issues. Infections, which kind of would result from the blood sugar issues, which is because that part of the limb is not getting enough blood flow, which would make it more easily for the person's limb to become injured and have infections from the cuts that they have, or severe burns, whether if the person has lost enough skin and it has reached their muscles and it just burned their muscles down to the point where they can't use whatever limb properly. The better choice is to just amputate it and have them go on and work on their other muscles and to counteract that amputation and have them live a better life. All right, so some of the pros and cons of amputation. Starting with the pros, it can stop the problem that is happening in the lower limb from spreading to other parts of the body, and that would be talking about cancer, which if a lot of times if the cancer is in the foot or calf area, they can do a amputation below the knee and hope that they do the amputation in time so that it stops the cancer from spreading. it can relieve pain from the patient that they might be having because of the health issues that they're having. So if somebody is just having infection after infection because of the poor blood flow and their skin just doesn't have enough time to recover, and so sometimes it just may be better for the amputation to happen so that the patient's not in so much pain. And sometimes it's easier to keep the patient alive if they're losing a serious amount of blood or the tumor spreading too quickly and could attack other areas of the body. Some cons, obviously the loss of the limb or parts of the foot or toes. That is probably the biggest con, which is a part of the biggest psychological barrier that the patient has. The patient not being able to return to a somewhat normal life, because sometimes it's a little bit difficult to go back and be able to think that you can do these things and then realize that you have an amputation, and sometimes your limitations are set to what they weren't before. Having to go through all of the rehab and learning how to walk again if you have a prosthetic leg or with parts of their feet missing. And patients will often have phantom limb sensation where they think that their leg or foot is still there, and they sometimes could end up hurting themselves, whether they would be walking or on a wheelchair. They could either be walking and there would be something there on the floor and they try and kick it away, and then they realize that they don't have a foot to kick it with. And other times, this typically happens right after surgery, is when somebody goes to put their hand on the bed, and where their leg would normally be, the person usually flinches because they're not used to having nothing there, and that would be the reason as to why they're flinching, because they think that they still have a leg, and oftentimes they still have the sensation that it's still there. So now for the different types of amputations. There's 5 main types of lower limb amputation, which are the foot, which include toes, below the knee disarticulation, transfemoral, and hip disarticulation. So the foot is, like I said, any kind of amputation that includes the toes, part of the foot, or even the whole foot. And toe amputations include mid-tarsal amputations, Liz-Frank amputation, Boyd's amputation, and Siamese amputation. Below the knee is a type of amputation that includes all areas from the right below the knee joint to the ankle. Knee disarticulation is anything that happens right at the knee joint, and if the surgeon can't do an amputation below the knee, this is typically the amputation that they go to so that they're not touching any of the muscle in the femur area. Transfemoral is amputation in all levels of the thigh from the hip down to the knee joint. And hip disarticulation is when they go right at the hip joint and they remove the entire leg, and obviously this is a rare case. And in this figure here is a brief view of where all of the different amputations would be taking place. How the doctors decide on lower limb amputation. If they determine that the cancer or illness is going to spread and affect other parts of the body, if the limb is no longer in good enough condition for the patient to use and would cause more harm than what is already happening, and making sure that the patient is willing to go through the procedure and the steps it is going to take and the steps that is going to take for them to return to a somewhat normal lifestyle. So the steps of being able to get back for the patient to be able to start exercising again. Obviously, first they have to have the surgery to remove the infected area. Before building back up the patient's strength and conditioning, they must make sure that the wound is healing the correct way. So make sure that the open area and the stitches and the stump are all healing the way that they should be. Then after about 10 to 14 days after surgery, light physical therapy can begin. This typically includes the fitment of a prosthetic leg if that was the type of amputation that would happen. And then after about 4 to 8 weeks, depending on how large the amputation was, the wound should be fully healed and the patient can begin more vigorous activities to build up their strength and conditioning. The benefits of exercise. Obviously, the number one benefit is building up strength and conditioning. Being able to go back to doing their normal activities and doing things independently, helping. It helps with the psychological aspect of having times to forget and clear the mind, and having the ability to not have to use an assistive device like a walker or a cane to help them do whatever task that they want to do, which is also touching on the being able to do things independently. So for medicine and treatments, obviously they would be prescribed pain medicine, antidepressants if they are having a tough time like going through mentally that they don't have that certain body part anymore. Maybe a change in blood pressure medicine if that was the cause for amputation, and checkups with the cancer team to see if all the cancer was taken out if that was the cause of the amputation. And for treatments, you would obviously go see a physical therapist, seeing a psychologist if you're having a tough time, and just like any other kind of surgery, having a good moral support around you helps a lot. So for my case study, which is based off a true story of my uncle, Mr. JB is a 49-year-old male who has type 1 diabetes, which was the cause for his amputation from the bottom of the knee. He lived a normal, active lifestyle. He wouldn't go to the gym, but he was always busy running around with his kids and going to the different types of sporting events and being active with them. He also has an LVAD machine to help with his heart problems that he was having, and just like any other patient, he was hoping to return to a normal lifestyle. For exercise testing, for starters, we would do a balance and fitness test to make sure that he is used to the prosthetic leg and can be able to get himself up and down from a seated position. For the balance test, we could either use a cane walker or have him walk with the parallel bars, which is the picture to the right. With this, the patient would either be walking by themselves and the doctor off to the side, or they would have the doctor pushing the wheelchair behind them in case they lose their balance, or have a doctor right behind them. And then next we would test strength and conditioning to see how strong his leg is that got operated on, and see how strong his supporting muscles are and how long he can do these specific activities. Depending on how confident he is, we could have him do a walking treadmill test at a fixed speed to see how long he can maintain that speed, or if he's not quite comfortable enough with going on a machine, we could have him do laps around a track in a controlled setting so that the only limiting factor would be his muscular strength and conditioning. For the exercise prescription, in the beginning, he will do laps around the house to get used to walking around with his prosthetic. We would have him do this 3 to 4 times a week and have it do it multiple times a day if he feels like he can handle it, while keeping his heart rate below 50% of his max. Also, he will do weight training for all other areas of his body to make up for the muscle lost, which would make it easier for him to support himself. This would be 2 to 3 times a week, 25 to 30-minute sessions, while also maintaining a heart rate at about 50% of his max. Once he gets used to the prosthetic leg and his muscular strength begins to improve, he can either take his walks outside or on a treadmill, and this would replace the laps around the house, so it would still stay 3 to 4 weeks or 3 to 4 times a week while keeping his heart rate at the same. His limitations are difficult because of his LVAD and his diabetes, so keeping his blood sugar and his blood pressure in mind is very key on prescribing and making sure that he doesn't overwork himself and make more issues. For conclusion, overall lower limb amputation can be very beneficial for somebody who needs to have it happen. The process can be very long before they are able to walk in good enough strength to begin exercising, but having a good support system around you can really help the process move along quicker and keep you in better spirits while going through the therapies. And these are my references. So thank you for listening, and I hope you learned a little bit about lower limb amputation, and thank you.